So welcome to case of the day, a new week, and we're on a 113th case. I did only 3 cases last week because Thursday was the Shera. But today we have an interesting topic. It's based on a new article that was published last week, and the title is The Concept of Reversible and Persistent MVO or Microvascular Obstruction. So the 72-year-old man had an ACS 5 days prior to the MR, which was done 2 days ago, and I reported it today. ECG showed a non-STEMI anterior wall infarct. A coronary angiogram had been done the day after the episode. It showed double vessel disease, LAD and circumflex, but the patient opted to come to Mumbai, so there was no immediate decision taken for revascularization. So then the patient became a candidate for cardiac MR. And you can see here on the short axis that there's severe hypokinesia and akinesia of the anterior wall and septum and the apical inferior wall, which is consistent with an LAD territory. The circumflex territory shows normal contractility. And on the early enhanced images, we see this area that doesn't enhance at all in the LAD territory, mid-anterior wall and septum extending into the anterolateral segment. And this is classic microvascular obstruction in the early image. The late CAT image shows that a lot of the infarct fills in, if that's the word you'd want to use, but there is some persistent black area which tells us that there is an element of microvascular obstruction, but a lot of what was there before has reversed. And so we would say that this is a partially reversible MVO or microvascular obstruction. What does this mean? So there was this paper that was published last week on the 24th of September in the AJR, which, I should have put AJR here, which basically talks about the relevance of persistence of MVO. And they divided MVO into 4 patterns. So one is there's no MVO at all on early or late GAD. Reversible, meaning there's complete reversibility, so no MVO on or no hypointense score on late GAD. And then partially reversible as in our case, and persistent where there is no reversibility at all. And they found that the ones who had persistent MVO had poor prognosis or a markedly increased incidence of major adverse cardiovascular events. Now, I discussed MVO in detail at mricardiac.com, and what I had said there was that these are dark areas or hypointense cores within the infarct segments, maybe intensely dark on the early enhanced images. And then this was all about intramyocardial hemorrhage, which is a subset of MVO, and that's what I had done. Now, coincidentally, the same day that we scanned our index patient, I had this patient with an LAD territory infarct in the apical septum, which completely reverses. So it is showing a dark core on early enhanced images, but it completely fills in on the late GAD images. So this is a reversible MVO. I had done case 8 about 4 months ago, and again here it was all about hemorrhages in an acute STEMI infarct. But if you see the images from there, the early and the late GAD, this is also partially reversible, though there's still a significant dark core here, but it would be classified as partially reversible. And from the case at mricardiac.com that I referenced, I had shown there this inferior wall infarct, which is pretty much persistent. So this is persistent MVO, which carries a much poorer prognosis. So to repeat, this is the table from the paper where you look at the pattern of MVO. So either it's not there at all, which means there's no dark area on early or late GAD. Then it's dark which completely reverses, dark which partly reverses, and dark that remains dark, right? That's the way to look at it. And if dark remains dark, then it's poorer prognosis. But it means that we should report this. These are easy terms to use. I know a lot of people do first pass imaging, they call it perfusion imaging, and you lose the window for early enhanced images. I don't do first pass imaging in viability cases. And so having an early and late GAD allows us to understand the pattern of MVO, IMH, etc. much better. And if you have early and late GAD images, then you can talk about reversible MVO, persistent MVO, etc. And if it is persistent, then it would imply a poorer prognosis. So I think at least I have started since I read this paper, at least talking about reversible MVO, partially reversible MVO, and persistent MVO in my report. And I think it's worth the effort. My WhatsApp channel, thank you so much for viewing this.